Hi, it's Dr. David Greene, founder and CEO of the U.S. Rehab Network. Today's topic are the top 10 ways to identify a drug seeker. Now, I'm not doing this video so that people can use it as a blueprint to how not to be identified as a drug seeker. I'm trying to help friends, family, and loved ones be able to identify a drug seeker so that they can have the opportunity to get him or her some help, okay? Now, the number one way to identify a drug seeker is a lost or a stolen prescription, especially if this happens on a recurrent basis. All right, a lot of pain doctors will make a patient who has a lost or a stolen prescription come in with a police report if it's stolen. So that can help prove that this was something serious, that the patient had something stolen. They actually went to the trouble to file a police report, and they can produce that for the physician. The second way to identify a drug seeker is if the person asks for a specific narcotic and maybe a specific dosage of a specific narcotic. Or the person says, well, I'm allergic to Percocet. I really only do well with Dilaudid of this dose or this brand. It can get very specific. And what that says is that this person's been around the block several times and they really want to, they know it works well for them, as opposed to someone who's opiate naive and just wants to get rid of the pain, as opposed to getting a high from the narcotic. A third way to identify a drug seeker is when they go into the physician and start to spew out basically textbook-like symptoms, or it sounds as if it's coming right out of a textbook. Well, I've had sciatica for, X amount of time, and it really hurts when you lift up my leg. It feels a lot better when I'm bending it. If they start spewing it out as if they memorize paragraphs out of a textbook, then that's a problem. That's a potential for a drug seeker. That's a problem. That's when they know what they're supposed to say and they memorize it and start to actually say it in the office. The number 4 way to identify a drug seeker is when they really exaggerate the severity of the problem. If they really don't have anything to show on the MRI or the x-rays, and the physical exam is kind of iffy, it can really start to reek of an exaggeration because the severity of the symptoms is much worse than the pathology of what's being seen. The number 5 way to identify a drug seeker is when that person has frequent out-of-town visits to a doctor. In this day and age, most states have a pharmacy database that can show what doctors are prescribing medications for that patient. Now, unfortunately, a lot of states don't talk to each other. So some people want to go from, say Kentucky to Florida to have visits while they're also being seen in Kentucky. But what they can see sometimes is they're going to a couple doctors in the same state. Now, this may be something that's difficult to see because if they're going to out-of-town visits with a doctor, a lot of pharmacy databases don't talk to each other. So the doctor may not necessarily know that they're going to somebody out of town. Okay, but sometimes they do find out, and that can be seen, and that's a red flag. The number 6 way to identify a drug seeker is signs of abuse. Now, this may be track marks. This may be constricted pupils. This may be nodding in and out when you or the doctor is talking to the person. It just might be an overt sign that they're taking too much medication or using illicit drugs or what have you. The number 7 way to identify a drug seeker is frequent visits to the ER with pain due to whatever they say in order to possibly get pain medication. Now, what is often seen by pain doctors is that a person will use their pain medication, but they'll take it too quickly, and then they'll go to an ER over a weekend to get maybe a 3-day supply or whatever they can until they get back in with the doctor. A lot of doctors will fire patients because of this. They didn't stick to their opioid agreement, but it's what's often seen as frequent visits to the ER to get a few days worth of narcotic medication. The 8th way to identify a drug seeker is what we call doctor shopping. So if a person is going to one doctor and using their insurance, and then maybe going to a second doctor and using self-pay as a way to try and get around the pharmacy database, it will probably backfire. The reason is that the pharmacy inputs the prescription regardless of whether it's from a self-pay or someone utilizing insurance. So it's not as effective of a method anymore. What's more effective is what we talked about earlier, is if a person goes to an in-state for one and then out-of-state for another. But a lot of clinics won't see out-of-state patients anymore, which is good, unless there's unusual circumstances. The 9th way to identify a drug seeker is if that person is new in the office and they just won't provide medical records. They say it's too hard to get them, or they don't remember the previous doctor's name that they went to for years. You know, it's basically just saying, I don't want you to have my previous records, because there you'll maybe see that I got fired by that pain doctor, or you can see that, you know, there was a lot of question marks around my behavior, or they tested positive several times for illicit drugs. You know, whatever the case may be, is they're trying to prevent the physician from being able to see those previous medical records. The 10th way to identify a drug seeker is if a person is non-compliant on their treatment protocol outside of the medications. Here's an example. A pain doctor will say, okay, I'm going to put you on this medication protocol, but we need to do this procedure so that I can help reduce the amount of opiate medications that you need. So what can happen is the person says, that's fine, they sign the opiate agreement, and they don't show up for their procedure. So they get rescheduled. They don't show up again. And they do that continuously, but they take their medications religiously. So what will happen is the pain doctor will fire the patient, potentially, and the patient will say, well, I don't understand. I was taking my medications as I was supposed to. Yeah, but you didn't. The doctor will say, you didn't show up for your procedures. This is an agreement between you and me, and we need to do this. So that's the 10th way they identify drug seekers, is if they don't want to participate in anything except the medications. There you have it. Visit us today at usrehabnetwork.com. We have plenty of treatment options for patients nationwide, whether it's for prescription drug addiction or an illicit drug addiction or other types of substance abuse as well. Feel free to give us a call at 888-598-0909. We'd love to help you. Thank you.